Gentleman from Oklahoma is recognized for 3 minutes.
Thank you, Mr. Speaker. I want to begin by thanking the chairman of the full committee, the ranking member of the full committee, and certainly the ranking member of the subcommittee and the staff for the tremendous assistance they provided in putting together this rather large and complex piece of legislation. It's fair to note for the record that the allocation we received, $156 billion, is $5 billion less than we had last year. And while our lower allocation this year has forced us to make some difficult decisions, I want to remind my colleagues that the cuts we're making today amount to barely 3% of what we spent last year and is essentially what we spent in fiscal year 2016. The bill before us today focuses on key national priorities: investing in biomedical research to find cures for diseases like Alzheimer's and cancer, ensuring our country is fully prepared and able to protect our citizens from disease outbreaks or bioterrorism, continuing to support early childhood education, particularly for those at risk, helping first-generation college students prepare for, access, and complete a post-secondary education, and continuing to support people living with disabilities. The bill also preserves funding for popular programs like career and technical education, support for historically black colleges and universities, programs to help Native Americans, the AmeriCorps program, LIHEAP, and the Corporation for Public Broadcasting. The National Institutes of Health, our nation's premier biomedical research agency, is funded at $1.1 billion above last year. NIH is working to find cures for Alzheimer's disease, cancer, and develop the next generation of medical treatment through the precision medicine techniques. We need to continue to build upon the $2 billion increase provided in the omnibus last year, and I view this proposal as a floor, not a ceiling, for biomedical research funding, and I'm hopeful that this number can increase as the process moves forward. Biodefense and preparedness programs, including new funding to prevent pandemic flu from occurring, are increased across the bill. We're all aware of the terrible toll that prescription drugs and opioids abuse are taking on our nation. I'm proud to say this bill includes another $500 million to continue comprehensive grant programs to enable states, localities, and tribes to develop anti-opioid initiatives focused on prevention, education, treatment, and recovery. Head Start receives a $22 million increase in the bill. Preschool programs are continued at $250 million. The child care programs receive a $4 million increase. Special education programs for students with disabilities by $200 million, which will help local school districts ease the financial burden of providing specialized educational services. TRIO and Gear Up, which help disadvantaged students prepare for and complete college, receive increases of $60 million and $10 million respectively over last year. The bill also includes $500 million for the Student Support and Academic Enrichment Program. These funds can be used flexibly by school districts across the country, whether the need is in the area of counseling, computer science instruction, or teacher training and arts programs. The Pell Grants are maintained at a maximum of $5,920.
I'd like to yield the gentleman another minute.
Thank you, Mr. Chairman. I also note that this initial allocation is the beginning of the congressional funding. As always, I'll look forward to working with our counterparts in the Senate, my friends across the aisle, to see if there's additional areas where we can cooperate. Finally, I want to note that the bill protects human life by continuing longstanding prohibitions against federal tax dollars being used to pay for abortions, and including new provisions to ensure that no tax dollars are used for research on human fetal tissue obtained by an abortion. This bill represents a balanced approach that will benefit every American and maintain the appropriate stewardship of taxpayer dollars that we've been entrusted with as members of Congress. So, Mr. Speaker, I yield back the balance of my time.